China's National Health Commission said at least 27 people have died from a fast-spreading coronavirus, as the total number of confirmed cases in the country rose to 830. Some 33 million people in China are now under travel restrictions. Shanghai Disney at a time when theme park would normally be packed with tourists during Saturday's Lunar New Year holiday. The deadly pneumonia-like virus was first identified on Deck 31 in the Chinese city of Wuhan in Hubei province. It has since spread beyond Wuhan, which has a population of 11 million, to other major cities such as Beijing, Shanghai, Macao and Hong Kong. China's finance ministry said it has allocated 1 billion yuan $145 million to support Hubei province in its fight to contain the outbreak. The city of Wuhan is also building a 1,000-bed hospital to treat the infected and plans to have the facility operational by early next week, Reuters reported, citing state media. Multiple cases of the virus have been confirmed in Thailand, Vietnam, South Korea and Japan, while the United States, Taiwan and Singapore have each reported one case. As of Friday, 10 cities with a total population of about 33 million were put under lockdown measures. Transportation services in Wuhan, the epicenter of the virus, were shut down on Jan. 23 and people were asked to not leave. The airport and train station in the city of 11 million residents were also temporarily closed. Other cities under lockdown include Huanggang, Zhantao, Ezhou, Qianjiang, Zhejiang, Chibi and Lichuan. Authorities have also cancelled Lunar New Year events in Beijing and other places. Airlines and rail operators are offering refunds on domestic flights and train tickets around the country. The virus outbreak is most frequently compared to the spread of SARS, or severe acute respiratory syndrome, between 2002 and 2003, when more than 8,000 people were infected. Around 800 people died in the crisis, according to the WHO. A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronaviruses are not dangerous. Some types of them are serious, though. About 858 people have died from Middle East Respiratory Syndrome (MERS), which first appeared in 2012 in Saudi Arabia and then in other countries in the Middle East, Africa, Asia, and Europe. January 2020, the World Health Organization identified a new type, 2019 novel coronavirus 2019 nCoV in China. By late January, there were 300 confirmed cases in China and a death count that was still in the single digits, but rising. And despite airport screenings, a traveler had brought the first case to the U.S. Often a coronavirus causes upper respiratory infection symptoms like a stuffy nose, cough, and sore throat. You can treat them with rest and over-the-counter medication. The coronavirus can also cause middle ear infections in children. Coronaviruses were first identified in the 1960s, but we don't know where they come from. They get their name from their crown-like shape. Sometimes, but not often, a coronavirus can infect both animals and humans. Most coronaviruses spread the same way other cold-causing viruses do. Through infected people coughing and sneezing, by touching an infected person's hands or face, or by touching things such as doorknobs that infected people have touched. Almost everyone gets a coronavirus infection at least once in their life, most likely as a young child. In the United States, coronaviruses are more common in the fall and winter, but anyone can come down with a coronavirus infection at any time. The symptoms of most coronaviruses are similar to any other upper respiratory infection, including runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus.